quick break. I just want to say thank you for all the people around the world, Jamaica, Germany, Asia, Europe, South America. Thank you for listening to Leap of Health. Thank you for the support. And remember, my book is out. You can find it on Barnes & Nobles and Amazon. It's called Parents Are Greatest Teachers. Thank you again for all the support. And now, back to our episode. Hello, everyone. This is your host, Alex Valgood, and this is Leap of Health. And today we have Katie Kennedy. She's a licensed doctor of physical therapy, and she's also super passionate about holistic health and natural healing. I believe you do also integrative medicine at your practice.
Correct.
That's awesome. And so we're going to be talking about all that today. Thank you for being here today.
Thank you. Thank you for having me. I'm so grateful and honored to be a part of the Leap of Faith. Or health. Yeah. Yes.
No, thank you. Thank you. And before we dive into the more scientific parts of it and medicine and all that, tell us a little bit about your story and how you came to marry these two worlds of physical therapy, which is more of the Western medicine, and the integrative medicine, which sees everything with a different eye.
Yeah. So I think that's a great question. And I always think that anybody who's on this path and journey has some story behind why they got into mixing multiple worlds together. And so I'm a traditional conventional physical therapist trained at Ithaca College, and I've been practicing for the last 6 years. And I've kind of been on my own health journey throughout that period of time since I was a kid. And so I loved athletics, I loved sports, and I loved exercising and loved being a part of that process, but really want to be more like the rehab. So that's really what got me into physical therapy. But what has gotten me here to this today is the fact that I've experienced so many challenges that I see in my patients that I'm like, I can't ignore the fact that the patients I'm treating and the experiences I'm having have some sort of commonality with something else that I'm not able to address or not aware of to address. And so I've always had interest in nutrition and interest in holistic and natural types of health and healing. So I took the step out away from doing it myself and doing it for other people, and kind of started integrating that together in the last several years because it's needed. And people are looking for that physical therapy approach that gets them better in a few sessions rather than this long drawn out process so that they can get back to what they love. But they also want health and healing and natural everything. And so that's kind of what brought me here.
That's amazing. Me, myself, I'm a massage therapist, and I've been working for spine surgeons for probably like 20 years now.
It's amazing.
So I've been working for them for a long, long time. And you're probably one of the only physical therapists that I know that sees things in a different way, as opposed to just very like, this is your physical therapy. You got injured, now you gotta go 2 to 3 times a week, or whatever it is that they're guiding you to do, or whatever the insurance pays. And that's pretty much what you're gonna do. And then come back and see me if you are not feeling better.
Yep.
And that's what I've seen for the past like 20 years, right? And in my experience, we do work with a lot of, just regular injuries. Mm-hmm. And also we work with like people that have gotten into car accidents, also, workers' comp. And it's just kind of crazy to see all these patients not getting better. I mean, there's a few of them, if they're like super healthy already before they got injured, or if, they have a different lifestyle, I think they have like a better bet to get better, as opposed to just kind of like everybody else that, maybe, they have to work overtime and they don't really have the time to work out and things like that. So it is so great to find someone that sees things in such a different way. And I think that's like super excited. I feel like, as you said, a lot of people are like, whether they just got injured or they've been injured for a long, long time, and they're like, what else do I have to do to get better, right?
Yep.
Tell us what some of the things that you do for people that come to you. How do you mix these two things?
So it's kind of like an art, as I'm sure you know, being a massage therapist, when you start learning different practices and styles, it's about this opportunity to marry things together in a very artful way. And I'm sure you know that every person you work with is going to be different, how you integrate them together. And so really it's more about how I outlook it with people. And it's that I want to help them reestablish the relationship they have with themselves and nature and the people around them, the things that are organic and living, and just helping them have a better relationship. And like, I think about this all the time, and it's like, how do you actually help people get better where they stay better? And it's like you help them develop habits, lifestyles, routines, rituals, and things that they can harness themselves. So it's really about me meeting the person where they're at and seeing them for who they truly are and seeing how I can best help guide them there in a way where it meets them where they're at, because not everybody is going to be ready to go gung ho. I'm sure you know that, and I'm sure you know that people are slow, and some people are fast, and some people have different paces. So it really depends on the patient, their needs, what they're looking for. But really, it is rooted in this framework and this conceptual kind of basis of reestablishing a relationship, and relationship is associated to a positive one with nature and yourself. So a lot of like reframing and neurolinguistic reprogramming of your brain and stuff like that. And so a lot of I now practice mostly virtually versus in person. And so this is a really cool experience to being not hands-on as much, to being completely hands-off with people, and to seeing like, what can I do to help get this person to feel better? And it's amazed me to realize that a lot of people already know what they need to get better. They just don't necessarily have the self responsibility or accountability just to do it on a daily basis. And so it's like helping them develop that and empowering them. So it's really, that's kind of how I marry it all together. It's because I do a lot. I do functional medicine, Ayurveda, physical therapy, yoga, other plant-based nutrition, herbalism, like functional movement, so many different things. So it's really hard to say like what specifically I do. I just kind of provide people with what they need.
And that's great. I think I had a guest a while ago, and it just stuck to me like forever. We are a whole system, right? That's how like she kind of like planted out, and she's like, we're a whole system. So
Yeah.
we cannot just see like my back hurts, or, you know, obviously in a specific cases, like if they had back surgery,
Yeah.
there's a thing there, but still there's a whole system that we need to address, even though
Yep.
you just had a surgery for like the back. But the
Yep.
back is also tied to your legs and your
Yeah.
shoulder and your neck and all these things, right? So, and if we go deeper, we have nerves that go through your stomach and
Yep.
your glands. And it's like such a broad thing that we need to start thinking about it like that, right? We're a whole system. So when we go to address something, we gotta see our whole body to
Yeah.
actually fix things. And I think that's how you what you have done to what your practice is. And I
Yeah.
think it's just like amazing to keep seeing you know, doctors and therapists and people like that that are there to help us in a more whole thing,
Yeah.
as
Yeah.
opposed to I just do acupuncturist, I just do
Yep.
physical therapy, I just do chiropractic care, I just
Yeah.
do, you know, whatever it is that they specify, which is great. But I feel like since we're a whole system, it's very
Yeah.
helpful when you go to a practitioner that has a bigger lens for everything. So that's really, really amazing. What are some of
Thank
the
you.
things that you find now that you see it as a whole system with your whole practice different than before, when you probably started and you were just kind of like doing physical therapy?
So yeah, that's a great question. So when I first started out, I had a lot of cognitive dissonance. Like, you know, that like what your heart feels isn't in alignment with what you're doing. And I really felt so heartbroken when I graduated college and got my first job. And they're like, here's a book. Here are all the exercises that we prescribe people for neck pain, shoulder pain, hip pain, X pain. I'm like, what? This isn't skilled care. This isn't what I went to college for. This is not why I got a degree, to help people. And so then it just got worse from there, where like it was seeing 4 people an hour for 8 hours. Like that's not, again, skilled care. And so like I said, my journey with my clinical practice and my career is kind of parallel to my own health challenge. And so I started out as a young age really interested in nutrition and health and herbs in more of a natural way, that there was like this cognitive dissonance with what I was learning in school and what the doctors were telling me. And so like it just took a while of me listening to everybody and not feeling in alignment with myself to realize I need to be more in alignment with myself. And that's like when I was like probably like 2 years out, 1 to 2 years out, I got really burnt out. And I was like, this is not a sustainable way of continuing practicing as a practitioner. And this isn't skilled care that I'm providing my patients. And the patients, I'm not providing them anything better than what they could receive like at another kind of like clinic. So it's not unique. It's not make like, because I've also worked with people that send me spine patients. Like one clinic I worked at, 50% of my caseload was spine people, and I was seeing 3 to 4 people an hour. So that's a lot of people every single day that are spine-based patients to be going through, and half of them are super messed up and have a lot of things going on, and they have 15 minutes with them. And so that cognitive dissonance kind of broke when I had my own health challenge come to the surface. And so since then, the last 5.5 years, I've been slowly making my practice more refined to what is more in alignment with my heart. And so it just takes time and learning, still learning.
Always.
It never stops.
And yeah, it never stops. And once you think like, oh, I have a great thing going, then you realize that there's something else that someone else is doing to heal people, a different modality that you're like, wow, that could be really cool if I can integrate that with what I'm already doing.
Yeah.
At least that's how I find it in my field. I also am a nutritionist, and I do a lot of different things, right? And I just believe that, our physical body or energetical body or heart or mind or soul, everything, like we have so many bodies in one.
So many.
Yeah. Right. That we have to like address a lot of them and see why we really have a back pain, or why do we keep having pain on our wrist for no reason?
Yep.
We call it no reason. Obviously, there is a lot of reasons, but we are so accustomed to be like, well, it didn't hurt myself, or or whatever it is. So I think it's just so amazing to find people that can see other than just one thing. And so I know you mentioned you are doing this thing online. What would you say to people like, well, I'm really hurt. How, like, this online thing for me to do with you sounds a little weird. What is it that you do that it's different from actually me just going for therapy for 30 minutes?
So it's really no different. The only difference is that you don't have to drive somewhere, worry about parking, and get in your car, get out of your car. You get to do it from the comfort of your home. The main difference that I would say, like, that's obvious from doing a virtual practice versus a brick and mortar practice, is not being hands-on with people. But there's a lot that you can teach people to do themselves and empower them to be their own healer, and empowering them to help their body naturally recalibrate its own homeostasis. And so there's a lot that can be done. And so if I'm limited, or if I think that person needs something more than what I can provide for them, I refer them out, I get them to another practitioner, and we work as a team. So I'm not like, I love working for people to help them reach their goals. And if I can't help them, or it's out of my scope of practice, I help them get that person that is necessary for that, because there's things that aren't in my scope of practice as a physical therapist and people are coming to me for assistance for. And I'm like, well, we can do that stuff for functional medicine, but you're asking me to do this and you actually need to be seeing your doctor to do that because I'm not legally allowed to do that. So it really, it's a lot of patient education, a lot of communication, but really the big thing is the comfort of being at your own home, not having to drive somewhere, which is one of the benefits. And two, I like to empower physical therapy as like not thinking of it like exercise or like an exercise program or it's something you do a couple times a week. Physical therapy is something that you need to do 24/7. So that is an embodiment practice. And so when you come to see me in a clinic and see me in that environment, that's great, but it's not immersed in the environment you're living in or that you're in 24/7 or you're in most of your day. When those movement snacks or those mobility snacks or those little things that you can be doing throughout the day that could be tinkered in are easy to integrate when I can see your environment and I can see what you're dealing with and what it's like. Because some people have, like I have dogs doing rehab stuff like right around when they're all excited and going is really not a good plan. And like having 30 minutes aside is not always like the best thing for us. So putting in like 1 to 2 minutes worth of like a rehab thing here and there and teaching people how to do that. And so my number one thing is empowerment. And I want people to be self-sufficient. And it is perfect in my world if you never need to see me or work with me again. And so that is my ideal goal for every patient is to get them so healthy where they don't need to work with me anymore and they just want to do optimization. But there is some differences, but the main thing is the fact that you're home, get to do comfort from where you're at, and we can help you navigate and problem solve on how to make it livable. Because a lot of people want to get rid of pain, but it's really like, how can you live with pain? Eventually it'll go away. How do you live with it?
Mhm.
And so it's about teaching people that stuff.
No, and that's such a great point. Because something that I do too, and I love that. I feel like I so feel what you're saying because I like to be showing people how to do self-care all the time because
Yeah.
I feel like when it comes with to physical therapy, especially and just self-care, they think that it's just like, okay, I need to go to physical therapy and do the exercise and that's it. And
Yeah.
I think it should touch on like the main point of the whole thing, right? It's not about just these 30 minutes. It's actually not that you're injured or that you had surgery or whatever it is. Now you have to really rethink life and be like, this is how I'm going to live forever. Now I just don't want it to get worse. So I need
Yeah.
to retrain on how to do all these ergonomic things at work, when I wake up, when I go to the restroom, when I take a shower, when I do all these things just like 24/7, just like you
Yeah.
said. And I think it's like so important. I'm always like so passionate about telling people and the patients, like, bro, this is not just like right now. This is like for real. If you
Yeah.
want to, have a better quality life, you really have to be on that. Like, okay, now I have to know how I do all these things on my daily life. And I think it's just like so important. I think that's one of the points that not a lot of therapists out there are telling their patients or their clients. And I feel in my soul is the
Mhm.
number one thing to do. And I'm so happy like that you mentioned it because it's so important. For the people that is listening, and that they have some sort of injury or something like that, even when it's chronic, we're not talking about you're going to be cured or you're going to be 100% like tomorrow, but you definitely will not get worse.
Yep.
And I think it's so like crucial.
Yes. And it is
Right.
missed. You're so right. It is very often missed.
Yeah. Why do you think is that?
Um, Convenience. And that there's what's difficult with a lot of people's psychology and their own perspective on things is they think they're going to get better by just doing this one thing. And then if it's not better, then it didn't work. rather than just sitting there and being aware of the process. Like people want that instant fix, that quick fix, that a pill for an ill, like immediate gratification, rather than realizing that the gratification is in the process and in the journey and in the embodiment. A lot of people aren't present. They don't want to be present.
Yeah. Yeah, for sure. And it kind of sucks because I feel like that's why we have so many people just injured for forever.
Yeah. Yep.
Is it right?
Yeah. Yeah. And they just, I think some people, and I'm sure you see this with the patients that have spine surgery, even when they've had it or have it years on. And I'm sure you can share great stories of how some people just don't get better. They just don't get better. And then it's like, why is that? And it's a lot of times they don't move. A lot of, like they say, sitting is the new smoking. And so there's a lot of our lifestyles change to be more in a stagnant position, and it's changing how the nervous system is experiencing the environment around it. And so it keeps these things persistent.
Yeah. No, for sure. And you're right. I have 100 million stories on that. And one thing that when you just said that, it just reminded me on like we also do knee replacements.
Yep.
And
Tons of those.
the first thing that they told is like you gotta walk. You
Mhm.
have to move. And
They
it's
don't
so
want.
crazy how, yeah, even the same thing with spine surgery. They're like, you need to walk, because movement is so important. No, because not just because they want to make sure surgery went well or see what's going on, like our
Yep.
posture, whatever, but because by moving, you're moving also the fascia. You're seeing how like the organs are working. It's like such a
Yep.
crazy thing, right? Tell us a little bit about how you help your patients mobility and like move better or start getting to move even after an injury or a chronic old
Yeah.
injury that they had.
Yeah. So this is a great question. And it's definitely a multi-layered answer because it depends on the person, their relationship with their pain in their body, and also if they've underwent any sort of previous trauma or have any trauma. And so every person I do approach in a very similar manner, but it's not necessarily the same, but like as a general framework with every person is I re-educate them that movement is the most important thing they can do for their nervous system. And so there's this concept called neuroplasticity. If you don't use it, you lose it. And when you have an injury and you immobilize something, it changes the sensory and the motor placement in the brain, and it makes it more smudged and less defined. And so when you use something, you can preserve function and preserve awareness. And so you're not creating any sort of distortion in your body's own reality to that injured space. And so every person I re-educated in that movement is the best thing you can do, but pain-free movement. And so that pain-free movement is going to depend because the inflammatory process has to go on. And that's going to go on for about 3 to 7 days before it starts to shift into more of that reparative, like proliferation, regrowing the tissue. In the beginning, it's about control, mitigate, get the inflammatory markers in there and out, and clear up any waste products and start repairing the tissue. And so in that first 7 days, it's actually the most important period of time to do like a low grade type of movement where you're not approaching your pain, but you're just kind of like, say your pain is like with your shoulder to that point, you just kind of move your shoulder to here. And so you just move it in a pain-free range and to develop that neural capacity to say, this is safe, this is okay. Every person in the beginning should be monitoring their breathing and focusing because you cannot heal if your nervous system is in a sympathetic state. And so you have to make sure your nervous system is in that parasympathetic rest and digest state. So breathing is a huge component of that. The rhythmic controlled motion is also a huge important of that. And I do incorporate restorative yoga postures with people if they need it, because it's like a warm hug in pillows and blankets, and you can just lay there and snuggle. So if someone has like a spine injury, low back injury, usually I end up starting with some sort of breathing or something like that to calm the nervous system and to
Mhm.
get things regulated and to teach people some gentle movements that they can do that are pain free. And so you want to, that's like the main focus. And then I transition people into moving into like graded pain exposure. And so what that means is that you're grading the person into that exposure of the pain. And so you don't want the pain to ever exceed a certain percentage of what they're experiencing, like 3 to 4 out of 10. But if it's staying around a 1 to 2, maybe a 3, and you get a little sore afterwards, that's a great example of graded exposure to pain, because the pain is going to be there with inflammation. The pain is going to be there with tissue repair, and the pain is going to be there with tissue regeneration. So if you can get the nervous system to get accustomed to that and not be such an alarm signal, and it's more so a sensation, you develop a better ability to progressively add and transfer load in the system. And so it's not like a clear cut answer of like how I take people through that, but that's generally how I do it with people. And it's about a graded exposure to stimulus, load, and if they're in a super painful state, pain. And so it's a counterintuitive. Like I have patients who tell me this all the time. Oh, it hurts. I don't want to move it. I'm like, well, I get that. I don't want you to move it into a painful range if it's going to be irritating, but let's move your joint in a way where it's not causing pain, where you feel confident and empowered by the movement. Because if you don't use it, you could lose it. Someone with a shoulder injury, it could turn into adhesive capsulitis if they have all the right comorbidities or predisposing factors. And so it's really important to and this is not old school thought. This is more of like the conventional thought, or not the conventional thought, more of the new conventional thought, to have that part of the rehab when there's any sort of injury. Yeah, there's times it's important to immobilize if there's like a fracture or there's an unstable joint or stuff like that. But ankle sprains, shoulder sprains, like rotator cuff injuries, like even muscle tears and ligament tears, like you don't want to immobilize that stuff for too long unless it's necessary. Like a complete rupture and tear, sometimes you have to do that till you get surgery, but some of them people are able to do like PRP, the platelet rich plasma injections, and they're able to get better without any surgery. So there's a lot of things out there that are really cool. And my
Yeah, totally.
yeah, that's kind of what I do.
No, that's great. I think just, everything that you mentioned, I think it gives everyone that's listening a better perspective of an injury. Like you can, obviously just in those cases that you just mentioned, if there's a fracture or something like that,
Yeah.
maybe keep it immobile, it's necessary. But other than that, mobility just in general, it's essential for optimal health.
Yes. Yeah. Yep. And it's
Eh,
always important too, if you have an injury, just to disclaim, is like get it checked out before you start doing like tons of movement, because it may not feel like it's fractured and could have a small fracture. And so like you will know based on your pain level and how you're feeling, but in general, just always get it looked at before. But yeah, people are always amazed with me when I'm like 2 sessions in, they're like, I was in so much pain and now I can do this without pain. And it's like, yeah, it's because your nervous system. And it's really that one thing you asked me earlier, what was like something that transitioned my career, and it was being more potently aware of the nervous system's influence on orthopedic injuries and issues.
mhm.
And so I'm a traditional orthopedic based physical therapist that treats neurologically.
No, that's great. I mean, it's so important, and we still like overseeing that part of how we do things now. So it's cool that you mentioned all that, and it also made me think of like how we grow older,
Mhm.
right? People are always like, well, I can't really move now because I'm old, or like this
Yeah.
hurts because I'm old. Like, I just can't stand that statement. To
Yep,
me,
I agree.
it makes no sense at all. I'm like, honestly, I just turned 40. It's kind of weird when I say it, but I'm like, I feel super young and I do a
Yeah.
lot of things that I did when I was like 20, right? And I think I'm in a better shape now than when I was younger. And I feel like you just have to, the key for longevity is movement
Yep.
in
Yep.
general. And we're not talking about like go super hard on 1 hour, do like weights
Yeah.
and like crazy yoga or like whatever it is that you think it, movement is.
Yep.
Literally walk around your block or
Yeah.
do 10-minute stretch. That will definitely do it. Even,
Yep.
the way I see it, my grandma, she's now like, I don't know, maybe like 80, I want to say 88, something like that.
Oh my
But
goodness, bless her heart. That's wonderful.
yeah, she's like pretty old, but not that old, right? And I feel like what it keeps her like on the still really good shape is that she wakes up, gets her bed ready, does whatever chores in the house they need to do. Like you need movement, right? You need to
Yep.
clean, you need to uh you know mop here, do whatever, but your body's still moving. So
Yep.
it goes to my example of like you don't have to run a marathon, but even you just cleaning your house every
Yeah,
other day, you will get
exactly.
your squats and like you're pulling and pushing, things like that, right? What are some of the things that you actually do for movement?
What was the last part
What are some of the things that you do for movement?
that I do for movement? So, like you said, just the main thing is I have 11 dogs, so I am constantly jumping and moving and dodging here and there. So there's a lot that is required for that kind of agility and
Oh my
athleticism.
goodness.
I'm
Yes.
just joking. But yes, walking, being outside. I do a it's I'm trying to think of the word, a methodology. I do a methodology. It's called functional range conditioning. And they have these things called controlled articular rotations, CARs. And that's something I do every single day. And I love doing them. They're basically you move the joint in its kind of max position in a rotational manner. And you're stimulating all the little nerve endings inside of the joint to help establish and carve out that motion in your brain. And so if you can't move where you can't move. Literally, it's just as simple as that. So it helps you develop more joint awareness and joint motion and joint range of motion. And so that's something I do a lot every day. Um, Breathing, that's another big one. Breathing practices. And truthfully, and I try to teach this to everybody, and this is not easy, and it's something I can guarantee you do, is having this embodied awareness so that in every moment of the day, like I'm just trying to check in with my body so that like my arches aren't flat and collapsed. I'm engaging the intrinsic foot muscles. My pelvis is in a neutral place for my spine. I'm keeping my ribs stacked over my pelvis. So it's like I've developed in my brain so that when I reach up over the counter, if I start to feel a break or a leak in the system, I correct it. And so as a physical therapist, I'm obsessive in my mind with this stuff. So it's easy for me to do this. And so I understand for like the normal person, it's like, wow, you're obsessive and weird. I wouldn't do that. But that's actually one of the best things you can do, not only from a physical health perspective, but a spiritual perspective too. Because if you can be present and focused in the moment, you can do so much. And it's just, sometimes anchoring your awareness on something is very difficult. And if you can anchor it on movement and your awareness on movement patterns, you're not anchoring it in past emotions and past traumas and negative related things. And so it can be a meditative process too. And so that's kind of what I do in a day. It's very unconventional. Like my yoga practice is like maybe 2-3 minutes. Like if I'm doing like a yoga sequence, we could just because I can't get anything done. Like right now is a great time. They're sleeping, but most of the time it's just complete chaos.
Yeah, no, for sure. And I mean, I think a lot of people that's into this type of work, we have that awareness. I get that a lot when I'm sitting. Like right now,
Yeah,
I've been sitting like kind of like in an angle, and my bed is like, "You're killing me
change it
at
up.
this. You're killing me at this point." And at work, I also do sit a lot, and I'm in front of the computer, so I'm super aware of like, gosh, I need to like straighten
Yep.
up. I've been like lunching a little bit. And but those are some things that it goes back to what we were saying. I had an injury too. So I have low back issues, neck issues, disc, whatever, everything that we probably all have in some sort of degree.
Yeah.
And I had to learn at a very young age how to sit properly, how to go to the restroom, how to, I'm engaging at all time. As weird as it sounds, when I'm walking, same thing is one of those things, but I had to
You
train
had to.
myself.
Yep.
Yeah. So when I think I was like 14, I had a bad fall and I messed up my back and whatever,
Gosh.
right? And so I learned how to like literally engage, even when I turn, I'm like, I gotta engage. And I feel when I'm not engaging, all my body is like out of whack. And I'm like,
Yeah.
oh man, get it together. Cause I know what it's like to be injured. And obviously my body is like, no way,
Yeah.
we're not going
No
back
more.
there. Exactly. So I think it's such an important thing, even though it sounds like weird to some of the people that are listening to us. I think
Yeah.
it's so important. Like really, you will be so happy that you're doing it. Like there's your posture, even when people are texting and they're like, whoever
Yep.
is seeing the video right now, like I'm like, bro, straight up, like
Yeah.
feel for a little bit, like there's so many, like even when I'm walking and I see someone in front of me, I could see the imbalances sometimes, and I'm like, God, you just need to do this little thing right here.
I know.
But I feel like if especially for people that's injured and they're listening and they have some sort of thing going on in their body, it's so worth it to just be and become a little bit more aware of your body.
Yep.
You will really do things in such a different way. And once you are like used to do it and over, it comes such a second nature. You don't have to
Yep.
even really put that much effort. Sounds like a lot of work right now, but believe me, in no time, you're like, I'm engaging on all time. I don't think about it
Yep.
because that's what
Yep.
I do my whole life now, right?
Yep.
So I
It
think
becomes a
it's,
subconscious pattern. Yep. You're so right.
yeah, what are some of the cool, like the tips that you give to your clients for mobility?
That's a great question. So, kind of like what we were just talking about, being embodied, that awareness, like what you're talking about. That's the main one. The second one about for mobility, this is a hard question because it's so all over the board. It's like, what should I choose? Um, okay, so this is a good one. The importance of just being patient and being like there. So the type of mobility work that I do involves a lot of getting into positions and engaging muscles and holding them. So it requires a lot of focus and discipline to do that activity. So it's kind of like a little bit of strength training too, but it's more so just like using your muscles against gravity. And so a lot of people don't want to be patient for that process. They just want to go all the way to 100 right away. But if you just either ramp up slow or you pick a steady rate that's comfortable, you can get you can get more out of it than you would if you were just trying to do more from it.
Mm-hmm.
The third thing is making it a ritual, making it a habit, and making it a part of like what you do on a daily basis, because from an Ayurvedic perspective, in that background of knowledge, that wisdom, there's the concept of the different doshas and these different energies in the body that are related to different biological tissues. And one of them being what's called the vata, or air and space elements, is really focused around the nervous system and movement. And so that makes sense. Air and space elements are movable. That makes sense that they're associated with the nervous system, which is a very motion based thing, in the joints and stuff like that. And so being developing that ritual and routine, what it does is it controls those elements so that as we get older and as we age, they don't become unruly and do their thing and cause that, how as you get older, things get dried out, things start to break down. It's because those elements are unruly, and they're unruly, blowing fire everywhere. And there's not enough of that rebuilding energy, that earth energy, to keep it from being withered away. And so when you do some sort of mobility training on a daily basis, or something that is a routine and a ritual, it hardwires resilience in your nervous system, so that when you're out in the yard or you're out doing something with family and friends and you misstep, or something falls and you trip up and you land on your arm in a weird way, your body has a natural resilience to that type of stress. It may not have been predicted for that type of stress, but you've stressed and strained your nervous system and all facets of your motion, so that when it's time for you to use it, you know your body can use it without you consciously having to do it. And so those, I would say, are like my most like three main things I tell people when it comes to mobility. I can't remember what the first one I said was, but I remember the third one. Yeah, I don't remember what all three I said just now.
Don't worry about it. People will rewind on this
Yeah.
if they wanted to
Okay,
listen to the
cool.
three of them.
Cool.
But yeah, I mean, mobility it's one of the main things to actually help and aid and just have the body ready for what's coming, whatever it is that's coming. So I think that's probably the perfect point to finish this amazing conversation, because I feel like mobility just, in just whatever spectrum is it, if it's a lot, for an hour or 5 minutes or 10 minutes or whatever, is just so important, because it will prepare your body to be ready for whatever is coming. And if you're going to get injured, you might get injured less than if you were not moving for a long time. So bottom line, I think mobility, if you're getting anything from this conversation, I think mobility, move your body, take a walk, walk with the dog, clean your house. Anything that is gonna make you move is just so important. And remember, you don't have to do it for an hour or two or being crazy about it. Little things will really pay it off in the long run in life, just in general.
Yeah, I agree. 1 to 2 minutes can be all you need,
Yeah, for sure. Is there anything you would like to say before we go?
Thank you so much, Alex, for having me on your Leap of Health. I think this is an awesome podcast, and I'm so grateful to be here to support your community. And, just keep honoring your body. That's all my message is just honor your body, stay present, and keep focusing on staying in that health focus.
No, thank you. Thank you. And for everybody out there that would like a session with Katie, I will put all your information on the show notes. Also, I will put all your social media links and all that for everybody to, contact you and message you, because I feel like there's not a lot of practitioners like you, and I think it'll be worth, for anybody that's going through some injury or whatever to talk to you. I think it'll be so amazing. So we'll put all your information on the show notes. And for everybody that is listening and would like to know more about me, you can always reach me at alexbalku.com. You can look me up on all social media. And also remember, my book, it's available on Amazon and Barnes & Nobles. It's called Parents Are Greatest Teachers. Thank you, everybody, for listening today. Thank you, Katie, and everybody have a blessed day.